Meanwhile, yet another mega surge in COVID cases in India. Prime Minister Modi is all set to chair a meeting to review the COVID-19 situation in the country at 4:30 p.m. today. The Health Minister, among other top leaders, are going to be attending this meet. India reports 1.5 lakh COVID cases in the last 24 hours. Cases are up by 12.4%, higher than yesterday. India's positivity rate has now surged past the 10% mark and stands at 10.2%. Over 300 deaths were reported in the last 24 hours. Kerala saw a massive surge in COVID deaths with over 240 deaths reported. The top 5 states with most cases include Maharashtra, Delhi, Bengal, Tamil Nadu and Karnataka. In fact, nearly 63% of India's total cases coming from these 5 states. India's Omicron cases has also surged. Total tally now stands at 3,623. Over 600 new cases of Omicron has been reported in the last 24 hours. Maharashtra continues to be the state with most Omicron cases, with the state's Omicron tally now crossing 1,000 mark. Shreya Chatterjee joining us live for more on that. Shreya, give us an insight into the rising COVID numbers. It's, of course, worrisome, but here, despite the cases on the rise, there's no lockdown that will be implemented as per what the state officials have said. Do give us through take us through exactly the numbers in the country as of today, along with Delhi, the national capital.
Well, yes, Nabila. In the entire country, we see that the active cases so far as COVID is concerned is almost nearing the 6 lakh mark. The positivity rate, as you rightly mentioned, is already crossed the 10% mark. And in the national capital, the positivity rate is almost nearing 20%. So that is the risk that we can also understand that the national capital is right now in, so far as the surge in COVID cases are concerned. But yet again, there will probably be no lockdown, as the state officials are very categorically mentioning. Today we saw the Delhi Chief Minister come out and say that there will be no lockdown.
Prime Minister is going to be holding a key meeting as well at 4:30. What do you think is going to be on the agenda?
Well, the meeting that the Prime Minister will be holding will be about a review on the COVID situation. It comes at the backdrop of the crucial elections that were already announced yesterday. And today the Prime Minister will take a stock of the situation. Even earlier, he had already held a meeting to ensure that safety was being measured in all the states where COVID numbers were rising. And that's exactly what he'll again be taking a stock of. The Health Minister will also be a part of the meeting, as we're learning.
Shreya, thank you very much for joining us with those details. Meanwhile, it seems like a shadow has been cast over COVID wonder drug Molnupiravir after the ICMR has now cast a doubt on its safety. But the pill is now selling like hotcakes amid the COVID surge in India. Here's more on that.
Merck's Molnupiravir was meant to be a wonder drug for COVID-19. After a green light by drug regulator, it is now available at several pharmacies across the country.
Different companies are making Molnupiravir and selling them at different cost price. There are some that are selling it for 2,000 rupees. This manufacturer currently is selling these 200 mg tablets for 690 rupees. So there are differences in prices also, but when you go to pharmacies, you will have to show a doctor's prescription to buy these tablets. And without the prescription of a medical specialist, the pharmacy will not allow you to buy these tablets.
And the demand for the pill has been surging.
इसकी सेल काफी बढ़ चुकी है। हमारे पास ही लगभग 3 से 4 दिन में 50 से 60 पेशेंट आके लेके जा चुके हैं मॉलनुपिराविर, और ये मार्केट में अब इजीली अवेलेबल है और बहुत सारी कंपनियों का लॉन्च हो चुका है।
ऑन प्रिस्क्रिप्शन ऑन डिमांड अवेलेबल है, उसमें कोई शॉर्टेज वगैरह ऐसी कुछ भी नहीं है।
However, the ICMR has still not included this antiviral pill in the National Clinical Treatment Protocol. ICMR DG Dr. Balram Bhargava's statement has raised concerns over this drug consumption in India. He said the drug is not safe.
We have to remember that this drug has major safety concerns. It can cause teratogenicity and what you have mentioned, mutagenicity, and it also can cause cartilage damage and can also be damaging to muscles also. Child-born could be problematic with teratogenic influences.
The ICMR DG said the drug was only approved based on a sample size of 1,433 patients who reported a reduction in severe symptoms in mild to moderate cases.
30% ये हॉस्पिटलाइजेशन कम कर सकता है, लेकिन सेफ्टी प्रोफाइल को देखते हुए इसका बहुत कम एक स्मॉल ग्रुप ऑफ पेशेंट्स में ही इंडिकेशन है. इसीलिए हम लोग डॉक्टर्स आज की डेट में मोलनुपिराविर को बहुत कम ग्रुप ऑफ पेशेंट्स में दे रहे हैं.
And yet doctors are prescribing it and patients are purchasing from pharmacies. The company issued a statement that read, and I quote, "We are confident in the clinical profile molnupiravir, which demonstrated a significant reduction in risk of hospitalization or death in our phase 3 clinical trial with no observed safety concerns when compared to the placebo group," unquote.
We have been witnessing how the sales of this particular tablet have increased in the market after doctors have started prescribing it as a curative treatment for COVID-19 as number of cases are increasing. But the health regulatory authorities like ICMR have said that molnupiravir can be dangerous in many people. It can cause many complications as well, and it can have problems in conception. Those people who will be consuming these tablets should use contraception for at least 3 months, because if conceived, the child could have certain complications. And these are the reasons why this particular drug is still not part of the national clinical protocol of the country yet, where medicines like remdesivir, ivermectin and Fabiflu were once part, but these are still not part of the national protocol. Yet doctors have been prescribing them and people have been coming to pharmacies to buy these medicines. That is the big question. With Pradeep Gupta in New Delhi, Milan Sharma for India Today.